If the nursing question asks you, who do you see first? This is one of the ways you need to decide, the ABC method. By ABC, I mean airway, breathing, circulation. The real question behind A for airway is, can the patient breathe at all? Nothing else matters if a patient's airway is blocked. For example, when the nursing question says a patient is choking or they have new onset stridor, which indicates that that airway is really narrowed, then that beats every other condition that is listed in the options. Now, when we talk about B for breathing, we're saying the airway is open, but the question is, are they breathing enough? On your nursing question, you want to pay attention to words like the rate of breathing. Are they breathing too fast? Or the depth of their breathing. Are they breathing too shallow? Or then the effort of their breathing. Is the breathing labored? When you see that option that talks about how the patient's breathing is labored and shallow, then you should start thinking about how that patient may need to be prioritized. C for circulation is talking about, is the blood going where it needs to go? Because we know that this blood is traveling to the different organs and supplying them with the necessary blood they need to function. Now, if your patient is bleeding or in shock, then this is a big problem. Once those organs start to fail, they are going to start fighting back by giving symptoms that put the patient at risk. Here's a quick example. You are caring for 4 patients. Which patient do you see first? A is a 1-day post-op appendectomy. Pain is at a 7 out of 10. B is a new pneumonia diagnosis. O2 sat is currently 90%. C, the chest tube is draining 100 mL in the past hour. This patient is post-thoracic surgery. And D, new facial swelling and hoarseness right after starting an IV antibiotic. Now, A and B are concerning for me because a patient who's having pain at 7 out of 10 post-appendectomy should definitely be intervened for. And then you have the patient who's starting at 90% with pneumonia, and we don't really like that 90%. It's quite low. Option C, a chest tube that's drained 100 mL and it's just post-thoracic surgery, could be very indicative of bleeding, and this could be a circulation issue. Option D is facial swelling and hoarseness, which indicates that that airway might be getting ready to close, and that's the option that we want to prioritize. So that would be your answer. Now, I know every question will not be this easy, but this is why you use the ABC method to sort through your options and then decide which one of them is bad enough to warrant your intervention right now. This question, option B and C were also concerning, but at the end of the day, the airway will always be the priority. So save this video so you can reference it next time you're stuck on a prioritization question and share it with somebody in your study group or just another nursing student who might find it beneficial. As always, guys, I'll be looking for your comments and I will see you on the next one. Bye-bye.